And then whenever you see this big, widely excisional sample, you can kind of cheat it. It should be malignancy. If not malignancy, usually you won't get this big chunk of excisional sample. Then you can see back hair follicle go down deep into the subcutaneous. So it should be from the scalp. Then tons of solar elastinosis. That means this should be a older patient. Tons of inflammation around. Look at this slick-like structure everywhere. Then we just zoom in to see tons of this blood channel lying with endothelial cell, but this is not endothelial cell. Look, the nucleus is really dark, almost like a lymphocyte, but they are really big compared to this red blood cell. There's really big cell, really scant cytoplasm, really high NZ ratio, really atypical looking of this cell proliferation, really infiltrated, really broad and deep, even go to the sub-Q. See, all of these are angiosarcoma, really infiltrated into a subcutaneous, and then they're forming this light structure to just dissect this collagen. That is the characteristic feature for angiosarcoma. Another case for angiosarcoma, also from the scalp, we can see hair follicle go down into the subcutaneous fat. Then we can see infiltrated border, tons of inflammation, reaction inflammation, and bloody. Let's see one characteristic feature, just this endothelial cell just dissect the collagen bundle to forming this almost like papillary structure. I think you still remember when I'm talking about the papillary endothelial hyperplasia, but during that lesion you will find all this structure just inside a big lumen of a thrombi vessel, but this one they just infiltrated everywhere, and then the cell is really dark, hyperchromatic, atypia, polymorphic cell. Then you know this should be a angiosarcoma. And then regarding immunohistochemistry staining, we already know we need to use classic blood endothelial marker. We usually use CD31. That is the cytoplasmic staining, a membrane staining, and then you can also use ERG. These two markers is really sensitive for endothelial cell. Some people may also use CD34, but I just would like to bear in mind CD34 may be negative in epithelial angiosarcoma. So CD34 negative could not rule out angiosarcoma. You must use your endothelial cell specific and sensitivity marker CD31 and ERG to highlight this lesion. If this lesion is related, like happened in the breast after irradiation, maybe in the head and neck tumor, the patient get irradiation and you get angiosarcoma, you can use CMYC to highlight this post-radiation angiosarcoma, and then you maybe you can for sure to tell the diagnosis. But if not related to irradiation, CMYC will be negative. And you need to also really cautious if you have a maybe look like vascular lesion but not really classic for angiosarcoma, and when you do the immunostaining CD31 negative, ERG ERG positive, you would like to call this angiosarcoma, you need to really cautious, because I happen to have a case that is myeloid sarcoma. For this myeloid neoplasm, they may have ERK positive. So always not to rely on one marker to make your diagnosis. This is another angiosarcoma. For this excision or maybe a deep punch, we can see all the dermis just infiltrated by tumor cell. You know, when you see this infiltrated growth, really dark dim, even into the subcutaneous, everywhere, highly suspicious for malignancy. Even low power, we can see this cell is really hypercellular, really busy looking infiltration of the dermis. And then we can see this slick-like structure. You may think, what's going on? Is it artifact or true vascular channel? But away from this area, to see this classic area, what do you see here? You can see this really dark nuclear, hyperchromatic cells, endothelial cell, trying to forming this blood channel, and then this endothelial cell also dissect this collagen bundle to forming this like wrapping structure, like a papillary structure that is really characteristic for angiosarcoma. The cell is really atypical, some are big, some are small, but really high NC ratio. We can also see prominent nucleoli, kind of epithelioid looking. Some epithelial angiosarcoma, they may also CK positive, so you need to be careful. When you do CD31 ERK, they should be strong positive. See, they're going really dark dim into the subcutaneous fat, forming this and dissect this collagen bundle, forming this characteristic structure. So this is another really nice classic angiosarcoma.